Welcome to Mental Health Mini number 41, Panic Disorder. Panic disorder involves having panic attacks as well as having anxiety related to developing another panic attack. A panic attack is something that occurs in response to severe anxiety. It generally lasts about 5 to 15 minutes, but it can last longer. In order to be considered a panic attack, the individual must have at least four of the following symptoms: heart palpitations, pounding heart, and tachycardia, sweating, trembling or shaking, shortness of breath or feeling smothered, feelings of choking, chest pain, which is often misinterpreted for having a heart attack. So, a lot of individuals that are experiencing a panic attack will actually go to the ER thinking they're having a heart attack because we do see a lot of those similar symptoms. They'll also have nausea and vomiting, feeling dizzy or lightheaded, especially if they're having that hyperventilation. If they have chills or hot flashes, they can develop paresthesia, which is numbness and tingling in their hands, their feet, or their face. They can experience some dissociative symptoms such as derealization or depersonalization. They'll have an intense fear of dying and an intense fear of losing control during the attack. Considerations for panic disorder physically is the hyperventilation can lead to acid base imbalance. As we breathe out too much carbon dioxide, their blood balance between carbon dioxide and oxygen can become imbalanced, and that can lead to seizure like activity. We want to monitor and make sure that someone having a panic attack is not having cardiac arrest. And as I mentioned, if the panic attack goes on for too long and the acid base balance becomes too imbalanced, they can develop seizures. Nursing considerations would be ineffective breathing pattern and maladaptive coping. Risk factors for developing panic disorders or panic attacks would be genetics, having a history of physical or sexual abuse, smoking, and having a prior panic attack. When we're assessing someone that has a panic attack, we want to assess the trigger of the attack, the duration of the attack, any symptoms that they experienced, how frequently they experience panic attacks, any preventative factors, the impact that it has on their life, and their psychosocial history. Treatment for panic disorders includes SSRIs and SNRIs for prevention, and then we can give a benzodiazepine for during the attack. Benzodiazepines are meant to be short-term use in PRN specifically for those that are experiencing a panic attack in that moment. We would need to educate them on the sedative and addictive effects of benzodiazepines, as well as the fact that it should not be mixed with alcohol because that can increase the risk of respiratory depression. During the panic attack, we want to make sure that we stay with that patient and offer reassurance and safety. We want to talk to them in direct, short sentences because their focus will not be great. We want to stay calm because they can pick up on any of our anxiety. We want to encourage deep breathing techniques to try and stabilize that hyperventilation so that it doesn't progress further. We want them to be in a low stimulus environment. If they're not an aspiration risk, we can give them a cup of water. By taking a sip of water, it forces their body to recenter their breathing so it can stop that hyperventilation. After the attack, we want to debrief with our patient, identifying any triggers or prevention. And we can also do panic control therapy. So, panic control therapy is a type of therapy where we induce similar symptoms to a panic attack and we teach the patient relaxation techniques. So, for example, we might have them run on a treadmill. When they're running on the treadmill, their heart rate's going to increase, their breathing's going to increase, they're going to experiencing muscle tightness and fatigue. And so it's very similar to some of the physical symptoms that someone experiences during a panic attack. While they're experiencing those symptoms, we can teach them deep breathing techniques, muscle relaxation techniques, and help them work through that so that when they do experience a panic attack, their body naturally knows how to respond to those things. The evaluation of the effectiveness of treatment would be decreased duration, frequency, and intensity of panic attacks, identification of triggers, identification of preventative factors, improved social interactions, improved occupational functioning, decreased avoidant behaviors, improved coping, and balanced respirations. And that wraps up our mini on panic disorder.